Welcome to this clinical walkthrough on the post-MI medication counseling case for UK-MLA, brought to you by Mediate, your 24/7 practice partner. All right, so here's our game plan for acing this station. We're going to break the whole consultation down into these 5 key sections. Trust me, following this structure is your ticket to showing the examiners a really safe, efficient, and patient-centered approach, right from the moment you say hello to that final piece of safety advice. Okay, let's set the scene. You're in a standard GP clinic, you're an FY2 doctor, and your patient is a 65-year-old woman. Now, she's just been discharged from hospital after a pretty serious heart attack, a STEMI, where she had a stent put in. The key thing is she's been started on 5 brand new and pretty crucial medications. And this is the heart of the station. Your patient is looking at you, probably feeling a bit overwhelmed, and she needs clarity and reassurance. Your job really is to take all that complex medical information and turn it into a simple, understandable, and, honestly, empowering conversation. So let's kick things off with Section 1, Clarifying Concerns. How you open the consultation really sets the tone for everything that follows. The goal here is to create a warm, welcoming, and empathetic space right from the get-go. You really want to nail these steps. After you've introduced yourself and confirmed her details, you need to acknowledge why she's there. A simple phrase like, "That's completely understandable," is so powerful. It validates all her anxiety. And please, before you jump into the meds, just ask a broad question like, "How have you been feeling since you've been home?" It shows you see her as a person, not just a prescription list. Okay, moving on to Section 2, your assessment. Now, before you explain a single thing, you have to gather your information. This is not just a box-ticking exercise, okay? This is about making sure your advice is actually safe and perfectly tailored to her. First, just briefly touch on the heart attack itself, just to check what she understands. Then, you've got to actively screen for red flags. So you're asking about the obvious cardiac stuff, palpitations, breathlessness, but don't forget the psychological side. Ask about her mood, her sleep, and then you're also looking for side effects from the new meds, like any headaches or bleeding. Next, you'll cover her background. You need to know about any conditions like asthma or kidney problems that could affect her meds, and always check for other medications and allergies. A really great way to structure the lifestyle chat is using the DASA mnemonic: diet, exercise, smoking, and alcohol. It gives you a quick, complete picture that you'll need for her management plan. Now, this slide is key. This is what turns a good consultation into a great one. I see. Exploring her ideas, concerns, and expectations shows that you respect her. It lets you tackle her specific worries head-on and adjust your explanation to what she actually wants and needs to hear. It's a game changer. We're now moving into Section 3, Reassurance and Empathy. So you've gathered all your information, but wait. Before you launch into teacher mode, you need to connect. This is a short but absolutely vital step that builds the trust you need for your advice to actually sink in. And this is a perfect example of the language to use. A simple, validating sentence like this can completely change the feel of the room. It just normalizes her anxiety and shows her that you're a supportive partner in her recovery, not just a doctor barking orders. Okay, on to the main event, Section 4, Explaining the Medications. Your goal here is to be crystal clear and super simple. Ditch the medical jargon. Use analogies. Make it easy to understand. So a great way to do this is to group them. Let's start with the anti-clotting team. You can explain that aspirin is a blood thinner just to help the blood flow more smoothly, and clopidogrel is its partner, working with it specifically to keep that new stent nice and open. Be open about side effects like an upset stomach or easy bruising, but in a calm, matter-of-fact way. The other 3 make up the heart protection team. You can say ramipril helps the heart muscle heal by lowering blood pressure. Bisoprolol is kind of like a brake. It slows the heart down so it doesn't have to work so hard. And atorvastatin is brilliant for lowering cholesterol and making the artery walls stronger. Again, just mention the common side effects, like that dry cough you can get with ramipril. And this is how you tie it all together. You have to summarize with this powerful, unified message. Framing the meds as a team is a fantastic way to drive home why they're all so important and why she needs to take them. It changes the message from, "Here are 5 random pills," to, "Here is your personal protection plan." And just before we move on to the final part of the consultation, don't forget that you can practice this exact case right now and get objective feedback on mymediate.com. Now, it's very likely your patient will have another key question, and you need to be ready for it. This one comes up a lot, and it's a really good test of how clearly you can communicate. And here's your perfect, simple answer. You can just say something like, "That's a great question. The appointment is just for a quick blood test. We want to check on your kidney function and your salt levels, mainly because of the new ramipril tablet." It's clear, simple, and shows you're being safe. Finally, we've reached section 5, planning, support, and safety netting. A really great consultation doesn't just fizzle out. It ends with a clear, safe, solid plan for the future. Your management plan has to include lifestyle advice, so you'll briefly touch on these 4 pillars. But here is the absolute crucial bit for the station. You must mention and offer a referral to a cardiac rehabilitation program. That's where they get the structured support they really need. Support also needs to be practical. Give her a leaflet to take home so she can review what you've talked about. Offer things like a pill organizer. And make sure you say out loud that you're there for her emotional well-being too, not just the physical stuff. Okay, your safety netting advice. This is non-negotiable and it needs to be crystal clear. You have to clearly separate the emergency symptoms like chest pain or major bleeding that need a 999 call from the other side effects like a nagging call for muscle aches, which just need a GP review. Getting that distinction right is vital for her safety and for the exam. And to finish, you're going to summarize the immediate next steps. Confirm that 1-week review for the blood tests, and just let her know that she'll have regular follow-ups after that. And try to end on a really positive, empowering note, praising her for asking questions. It shows her she's an active partner in her own care. So there you have it, a structured way to approach and master the post-MI medication counseling station. If you follow these steps, you can provide really clear, empathetic, and safe care for your patient. And to put it all into action, you can practice this exact case now on mymediate.com.